In this procedure, you will learn how to inject 0.5 milliliters of vaccine into the patient's Vastus lateralis muscle using a 22-gauge, 1-inch needle. Read the order and clarify any questions with the provider. If you are unfamiliar with the medication, refer to the PDR, online drug reference, or package insert to determine the purpose of the drug, common side effects, typical dose, and any pertinent precautions or contraindications. Be prepared to answer any questions the patient's caregiver may have about the medication. Use the 7 rights to prevent errors. Check the patient's record for a previous allergic reaction to the Hib vaccine. Greet and identify the patient and the patient's caregiver. Using the child's full name and date of birth, compare the child's name and date of birth to those on the order to confirm her identity.
Hi, I'm Julie, Dr. Anderson's medical assistant. How are you two today?
We're doing well, thank you.
Good. Could I get Clara's full name and date of birth?
Sure, it's Clara.
Make sure the caregiver has received the Hib VIS form and that her questions have been answered. Before administering an immunization, confirm that the caregiver has given permission for the child to receive the immunization. Explain the procedure to the caregiver. Check the child's temperature and ask the caregiver about recent illnesses.
Has she been sick recently?
No, she is not.
Great. We're just going to get her temperature.
Okay.
Just to make sure.
Refer to facility policies if the child has a fever and or the caregiver reports a recent illness.
All right, 97.6, we're in good shape there. So now she's all set to get that Hib vaccine. So can I have you lay her down for me?
Sure.
Position the child on her back. Ask the caregiver to remove any clothing necessary to expose the child's thighs. It is important to expose the entire vastus lateralis muscle to prevent injury to the child. Choose the right or left thigh for the injection. Open alcohol wipes so that they can be grasped with one hand. Loosen the needle cover while keeping the needle within the cover, maintaining the sterility of the unit. Locate the injection site. The pediatric vastus lateralis site is located below the greater trochanter of the femur, but within the upper lateral quadrant of the thigh. Grasp the muscle with your non-dominant hand and clean the injection site with the alcohol wipe, using a circular motion and moving outward from the center. Ask for the caregiver's assistance in holding the child still if necessary. Remove the cap from the needle by tipping the loosened cover downward while maintaining the sterility of the needle unit. With the thumb and first 2 fingers of the non-dominant hand, spread the skin at the site tightly. With your dominant hand, grasp the syringe as you would a dart, and with one swift movement, insert the needle at a 90-degree angle into the muscle. After the needle has been completely inserted into the skin, release the muscle that you are grasping. To prevent discomfort for the patient, do not move the needle while injecting the medication. Use your non-dominant hand to depress the plunger. Aspiration is no longer recommended with pediatric vaccination injections, but you should follow the facility's policy. As the needle is pulled out of the skin, hold a gauze square next to the needle insertion site. Immediately activate the safety device and discard the unit in the sharps container with the needle first. Massage helps increase absorption and reduce pain, but is not recommended for certain medications. Follow your facility's policy on massaging the injection site after drug administration. If permitted, press or rub the site for a few seconds. Make sure the infant is safely held by the caregiver. Observe the patient for 20 to 30 minutes for any adverse reaction. Dispose of your glove and sanitize your hands. Document the vaccine administration in the patient's health record and complete the vaccination log according to office procedure. It's important to keep an accurate record of vaccinations performed so that the next dose is timed properly. The immunization record or vaccination log must be completed each time a vaccine is administered. Information includes the manufacturer, batch and lot numbers, which are stamped on the Hib vial, expiration date, dose administered, route of administration, and whether there was a patient reaction. You must also record that the caregiver received a VIS form and that any questions he or she had were answered before the vaccine was administered.